Our guest today is a physician assistant that specializes in aesthetics and anti-aging. Please help me to introduce Cindy.
Hi, I'm so happy to be here, and I'm so happy to have you here as well.
Amazing, thank you.
You're welcome.
So I always like to ask my guests, how have they been since COVID-19?
So since COVID-19, I've been really good. I actually feel like, during that time with lockdown and being furloughed as an employee, it really helped me to look into myself, as it did a lot of people. It really challenged your mental health. Being home, being alone with your thoughts. More importantly, even my personal life, dating, realizing that, you may not be dating the right person, and really just sort of finding what your passions are, finding, what's important in life, family bonding. Overall, I came out a lot more mentally stronger than before and during COVID.
Amazing, amazing. That's great. I have talked to a lot of people and they always say, like, some people, it has been bad for a lot of people, but a lot of people have grown and become better versions of themselves through this pandemic. So that's amazing.
Absolutely.
How big do you think mental health is in the aesthetic industry, especially when you're speaking to patients and things of that nature?
So huge. Mental health affects everything, physical well-being especially. And that's one of the reasons why my passion was fueled for aesthetics. So I feel like aesthetics is a vessel for healthy mental health. So when you look good, you feel good. Especially for me, when I go in the mirror, I'm like, damn, you look good, girl. I really feel like I can conquer the world. And there's a stigma associated with people feeling superficial because they want to get work done, Botox and fillers. But the very truth is that when you can look in the mirror and feel confident in yourself, it really helps you to feel healthier as an individual. I don't know if you've ever heard of The Secret.
Yes.
Yes. So The Secret, essentially, whatever you are thinking comes into fruition. And I'm a firm believer in that. If you can really change your mental health and really have mentally healthy and sound thoughts, you can really be a productive human being.
I couldn't agree with that more. Manifestation is what literally I built my whole world around. I feel like I manifest everything I have right now and in the future. So I believe that wholeheartedly. Amazing.
Yeah, definitely.
So take us back to the beginning. How did you get started in the aesthetic industry and what made you want to get into it actually?
So, I grew up as a tomboy. I grew up around nothing but men around me. I used to be a tomboy everywhere I went. And then all of a sudden in high school, I just started getting into makeup, hair, heels. And I would go to school in 11th grade in high heels. And I just always wanted to look and feel my best. And I wanted that for other people. And finally, when I hit PA school, I told myself that I really wanted to work in either a dermatologist's office or in the aesthetic industry. And I think a lot of my classmates could see that because I'd be the one who'd come in, super done up, ready to study, no matter what, even if I was up for 10 hours. And it just really did make me feel good. And so even in clinicals, we would be doing pap smears and I would be focused on, the texture of the skin or ways to enhance that person's beauty. And so I knew it was for me, and eventually through one of my best friends, I was able to break into the industry, and it's been an amazing time since, and I'm really passionate about what I do.
Wow, amazing. I meet so many providers. I always ask them this same question. I know there's no like residency or like for doctors or even for like PAs, there's no like thing that you can study fellowship. So how did you like get training in aesthetics? How did you learn the craft?
So thankfully I was able to do a really intense internship. And through there we were able to assess many different faces with one of our lead practitioners and also one of our supervising physicians. And from there was able to build the craft, especially become ambidextrous, learning how to work with both hands and learning how to work mechanically, because a lot of this art requires you, knowing how to hold tools, knowing how to do injections, use needles, things that we aren't necessarily taught in school. So highly specialized training, especially one-on-one, is extremely beneficial.
Amazing, amazing. And how do you feel like you're comfortable, ready to go on your own, I guess, after training?
So after a while, you just have no issue with a needle.
Yeah.
I remember I used to be so afraid to even touch a needle. I've poked myself with sterile needles many times, and you're so afraid and nervous. I don't know if other injectors can, relate to this, but because you aren't given too many needles in school and you don't suture as much, let alone now you're injecting someone's face, you're really nervous and needle shakes.
Yeah.
But after that needle becomes like your best friend, you're good to go.
Yeah.
Even myself, like I inject myself and I have no issue with that. I stare the needle right in its eye and I literally inject myself with ease. Also, being comfortable with your clients as well, knowing what works for who, what's best for whose face, becoming adept at really assessing someone's facial anatomy and knowing what would be great for them. I feel like that's when you really know you are ready to flourish.
Amazing. That's great. And that's sound advice, honestly, because no matter how much you practice, until you actually do it on your own, you never know if you're going to be ready.
Absolutely.
So that's really great advice.
Yeah.
Amazing. So tell us a little, one of the reasons I wanted to have this conversation with you is because I talk to a lot of different injectors, and they treat a lot of different skin types, but none of them, I would say, really treat ethnic skin. And I wanted to go into deeper detail with you to kind of tell us a little bit about the difference between ethnic skin and how you may approach the type of clientele like that.
Yeah, absolutely. So thank you for that, because I feel like, there's a stigma going around in our community. Black don't crack, right? We crack, okay? So I think Botox and fillers would benefit any and every ethnic group. The whole goal is anti-aging.
Yeah.
And so certain groups, you learn how to work with their facial features. So for African Americans, sometimes we tend to have a larger nose. Sometimes we, tend to have beautiful, luscious lips.
Yeah.
So you have to be very particular about who you decide to treat when it comes to lips. How much syringes you would use for someone's lips, versus someone who, let's say, is, Mediterranean. You use that discretion in learning how to treat individuals. And then as far as just anti-aging as a whole, I think it's wonderful that because it's such a stigma in our community, it's great for people to see, someone that looks like them, because unfortunately and fortunately, it instills trust in that person. There's a certain type of people that get plastered when it comes to treatment of fillers and treatment of neurotoxins, and it's not something that our community speaks about too much. I do treat a handful, but I'd like to see more. Even my own mom, my mom is like, oh no, I don't crack. She's like, I don't need Botox. And I'm like, Mommy, yes you do. And even myself, it took a while for me to actually get any sort of aesthetic treatments because, I told myself for a long time I'm okay. But the truth is this stuff is preventative. It's anti-aging, and, the goal is to be forever young.
Yes, definitely. Why do you think there's such a big stigma around it?
Because I feel like, number one, what the media portrays, it's not very often that you see, people of color who are getting these treatments. You have to also think economically as well for people who aren't able to financially, for people who aren't able to afford these sort of treatments, it's not something that they're going to go and venture off to do.
Gotcha.
So I feel like a lot of it is education about skincare. I don't know about you, but growing up, no one ever told me what it meant to cleanse my face with, a cleanser, to use SPF and moisturizer. I was never told to use sunscreen when I was out in the beach. I was never told what a retinol cream was. And Botox was frowned upon because we associated it with people who walked around with really tight foreheads who looked very fake. Yeah. But when procedures are done naturally, you get natural results. And the biggest thing is prevention. And so just getting your, serial treatments of Botox, even if it's just a little bit, and, even getting some filler never hurt anyone, So I hope that answered your question.
No, that does answer my question. And the reason I asked that question is because, like, even like what you just said, I was taught to like wash your face with like black soap growing up.
Right? Dove, my mom would give me Dove soap and be like, hey, just clean your face with the Dove soap. Not saying Dove soap is, bad, but there are certain cleansers tailored to skincare. Yeah. And then, also Botox. Botox, my mom and I would watch Real Housewives of, say, Potomac. And everyone is like, they are beautiful women. But again, it's frowned upon because, that's work that's overdone. But it's important for people to educate themselves and know that this stuff is preventative treatment.
Great. Yeah, no, I agree. So I would love to ask, being in the industry, getting into the industry, how important do you think it is to look good and actually feel good and actually work out and everything? How important is image being a provider?
So it's kind of like, you go into a nutritionist's office, and again, these things exist, and it's not saying that these individuals don't have the educational capacity to help you, attain your goals physically and losing weight. But again, like I mentioned before, seeing a Black provider, it's going to draw in likely more young Black females who feel like they understand the skin better, whether or not that's wrong, but it's just how life works. So if you're walking into an office and, someone doesn't necessarily carry themselves the best, look good, smell good, 9 times out of 10, you're probably not going to want to proceed with treatment because, physically, they're not what you're envisioning for yourself, if that makes sense. I really do feel like that makes an impact on things. In the aesthetic industry, it's aesthetics. So, you got to wake up, you got to iron that extra wrinkle on your shirt. You got to make sure you have nothing in your teeth. You know what I'm saying? I hope I don't. It's extremely important. Yeah.
No, and I'm glad you explained that because I speak to a lot of candidates in the industry, especially starting off after school. And, I try to tell them these things that it's not just, hey, I pick up a needle, I'm going to do this and I'm going to be doing this for a side job and that's it. It's about really putting everything in it as far as like the looks, the education. Mm-hmm. I mean, you can explain more. But
exactly. And one important part, first and foremost, is the education. Yeah. So no one who looks amazing should have any business sticking a needle into your face. Yeah. Very important that you understand and know facial anatomy. And then the looks part, gets added onto it. And when we say looks, we don't mean, you have to, walk around looking like, Tyra Banks or Kendall Jenner, but just essentially carrying yourself with confidence, taking care of your hygiene. No,
and that's a good point that you actually touched on too. I've had a lot of great injectors honestly not get jobs because of their confidence level. Mm-hmm. When patients, what I've been told by a lot of owners of med spas is when patients come in, they're looking for an injector that is confident in the procedures that they're going to give the patient. Do you agree with that?
Absolutely. Yeah. So you never want to be in a room consulting with someone and saying, maybe, or in the end, people sense your energy. Yeah. I remember starting off, and I'm sure people can resonate to this. A lot of injectors can resonate, but when patients sense when you're nervous. Yeah. Your needle shakes, you're unsure. There's a certain way you kind of insert a needle into someone's face confidently versus with slight hesitation. And patients can sense that. In all industries of medicine, we can sense, or all specialties, we sense when someone is nervous. That's why a lot of people are sometimes afraid to have students come into the room. But then I get the complete opposite where, a lot of clients or patients feel like the student is, more well adept than the actual provider,
Wow.
because of that confidence.
Yeah.
Because they command the room when they walk in. Confidence is everything, especially in this industry, because again, you're not given, a handbook on aesthetics in school. You kind of learn as you go.
So I wanted to talk a little bit about general medicine and kind of like CPR and things like that. I know we talked a little bit behind the scenes about that.
Yeah.
Tell us how important it is to actually know those things as an injector.
Oh my God, super important.
Yeah.
So actually this was a conversation. Can I shout out?
Yeah, go ahead.
Okay, so this was a conversation I actually had with Pretty Girl PA, one of my best buddies ever. And she was saying, you know, the importance of continuing medical education, especially when you're in a very specialized industry like aesthetics. Sometimes there's so much, medicine is such a vast world.
Yeah.
There's so much information thrown at you. There are certain things you need to make sure you know. And sometimes injecting 24/7, 7 days a week, sometimes you may not know the dosage of a certain antibiotic to give someone for a common cold. These things slip your mind. So super important that you continue your medical education, research articles, look up the latest technologies and latest therapies for certain ailments. Because that is what truly makes you a dynamic provider and even a good aesthetic injector. Because I've had patients who come in, I've treated people with tremors in my chair,
Yeah.
You have to know how to kind of maneuver that. Or, certain things that someone will tell you like, hey, I've had a really bad sore throat. So you may want to be careful injecting someone, who may have strep throat or may have a viral illness, even being cognizant of wearing your mask. I've had situations where people have thrown up on me while I've been injecting them. Yeah.
Oh, wow.
So knowing medicine and not just aesthetic medicine is super crucial to your craft.
Amazing. Wow. I can agree with that. I see with the experiences. How did you handle that situation by chance?
Oh my goodness. So I feel like a lot of people who I tell this story to, their natural reaction is to get away. But I cleaned her up. Sometimes people are really nervous. And I find that, the people who are tatted with full sleeves, even tattoos on their face, are such chickens when it comes to a little filler or even a little Botox. They are so nervous. And so sometimes they get vasovagal syncope, sort of where your anxiety just kind of induces, you passing out, which has happened to me several times. And I'm sure many injectors can resonate with that. Or that one particular time where, she vomited. She saw the sight of her own blood and kind of freaked out and threw up all over me. So I cleaned her up first. I cleaned myself up, gave her a few minutes. We gave her a nice IV. And then we got back to work. She was a trooper.
Amazing. Yeah. Wow. That's great. That's great. So talk to me a little bit about social media.
Okay.
How big is social media to an aesthetic provider?
I feel like social media, so there's a debate going on. So I talk to, a lot of people who say that word of mouth gets you a lot further than social media. So to all my fellow injectors out there, I want to know their opinion also. Do you feel like word of mouth kind of really helps draw in clientele or social media? I do feel like this day and age, social media is crucial. You have to consistently post a lot of your work and also the types of people you post, whether it be young, older, male, female, again, different ethnicities to see the range of your work. But more recently, I've also learned that being more personable matters. So people don't just want to see work every day. They want to see you. They want to see what your day-to-day is. Most recently I posted that I got a burn from a Harley. I can't tell you how many women reached out to me in DM saying, I've done that too. Big lesson learned. Yeah. But those moments really help to connect with, a lot of your patients, and that keeps them coming back as well. So myself, I'm trying to, post a lot more about my daily life and a lot of my experiences. But again, word of mouth, I really feel like helps a lot. I can't tell you how many people have come to me because their best friend was treated by me and they heard so much about me, but don't even have Instagram or Facebook. So
wow, that's a really good point that you made, and I want to expand upon that just a little bit. So do you feel as though you might be a brand in yourself, even though, as an injector, you work in a med spa, but people are actually coming to see you, so you have to be that brand and keep that brand up?
Absolutely. So people want to know who did the work.
Yeah.
So you have the med spa,
yeah.
but who specifically touched that person's face, because I want that same person to touch my face. Same applies for any other area of medicine. You go get a pap smear. You don't want the gynecologist that, hurts people. You want the one where, he did a great job. I don't know why I keep going back to gynecology, but so definitely have to brand yourself 100%. And there's always a face behind every single injection. Who did that injection? What education do they have? What experiences do they have? Very, very important.
How did you come up with your name, Beauty Genie?
So actually a really close friend of mine, we were brainstorming names, and essentially he's just like, I feel like you are a people pleaser and you always want to make wishes come true. So we'll call you Beauty Genie. And so I've kind of had my ponytail in and I'm ready to make everyone's wish come true. And I really actually take that very serious. It's not just a playful name, but when you sit in my chair, whatever you desire, I am here to try my very best. And 9 times out of 10, I reach that to make that happen. Yeah.
How do you handle a patient that might come in that maybe wants treatment that's a little bit more than what you're willing to give? So maybe like a little bit more overfilled or things of that nature.
So this is where, again, knowledge of other specialties in medicine come into play. I used to work in internal medicine. So that's actually a perfect example and ties into what we talked about knowing, when it's appropriate to treat someone and knowing medicine. So here we encounter a lot of people who may suffer from body dysmorphia or a lot of psychological issues. So you really have to just, it's okay to deny treatment. I've had to do it, a handful of times where you suggest something else to sort of help that person rather than continue to feel an area that you just don't feel is right. On the other hand of things, if that person is just not budging and really wants that treatment and really feels like that'll make them happy, I'll do it, but I won't post it, simply said. And again, I think a lot of injectors can resonate with that. That's not something that I would agree to do. But if they are pressing, maybe I might do a half a syringe or maybe I might just do a little bit. But again, a true artist will see other areas that they can really help that person and really, you're a very convincing individual when you work in aesthetics. You have to really have a vision and kind of articulate that vision to your client or patient.
Okay, amazing. So there's a learning piece, obviously, to aesthetics. There's a sales side to aesthetics.
Absolutely.
Being a provider, I think a lot of providers don't really understand that. How long did it take you, or when did you know that was there?
So right off the bat,
Yeah.
I mean, this is a very lucrative industry.
Yeah.
And with that being said, you cannot lose yourself in selling.
Gotcha.
You need to sell, obviously, what's beneficial to that patient. And I think that's what separates good injectors from bad injectors. You'll notice an injector who is really about their coins and just, fills and goes about their way. But again, a true artist and someone who's really passionate will not give inappropriate counsel or medical advice to someone if not needed, Also being charismatic. So you never want to appear too pushy. So, hey, buy this, buy this, buy this. There's a way to articulate yourself. It's almost like being poetic with your words. And then very important is instilling confidence in that person, but not breaking down who they are. Because you can throw out so many things, Kybella, filler, Botox, and really affect someone's self-esteem if that's not what they came in for and that's not what they're sitting in your chair for. So it's almost like being poetic with your words, as anyone is. Political, political individuals have to be very poetic with their words as well. And that all will tie into your selling capabilities. Sometimes it can be uncomfortable, but it's just part of the job.
That's a really good point that you mentioned too, because it can actually backfire on you if you try to sell too hard. It's like, hey, I don't even want this stuff. What are you saying? Something's wrong with me?
Exactly.
So that's a really good key point that I think
Absolutely.
a lot of people can learn from.
Yeah.
Great. So tell us a little bit about what's your favorite aesthetic procedure.
So I'm really into recently full face rejuvenation. So I can't point to one specific area that I love to treat. I really love seeing how serial treatments of Botox, even paired with skincare like microneedling or multiple syringes, can do to someone. A lot of my most recent clients, we were able to naturally rejuvenate them with a handful of syringes, and that's really my new jam, just being able to rejuvenate individuals. And you know, the beauty about that is you spend 2 hours on someone's face, and then once you hand them the mirror, it's almost life-changing to see their reaction. So yeah, but again, they're really, when we tie back into mental health, looking your best and really taking care of yourself externally really directly affects how you feel internally.
Wow. Wow. Do you see a lot more men coming in to see you, or how has it been changing? Tell me a little bit.
Definitely. I think you spoke with another injector about this, but usually if the straight men are coming in, their, you know, significant others are kind of pushing them to do it. But a lot of the men in our gay communities, they are very cognizant about how they look aesthetically. Yeah. But I'd be surprised, especially lately, you'd be surprised to find that a lot of straight men come in and they're into fillers. So that's why a lot of this ties into education, especially going back to when we were speaking about, you know, ethnic populations or people of color. I feel like a big chunk of why they don't seek these treatments is because they don't know what they are. You hear toxin, you freak out. Yeah. But if you really sit down and really get a full idea of what this stuff is, they become a lot more open to it.
Awesome, awesome. How big is continuous education for an injector?
Crucial. Again, because sometimes, again, you'll have people sit in your chair and you need to use your discretion of who to treat and when to treat them. Yeah. So there are many contraindications to treatment with dermal fillers and neurotoxins. So knowing medicine as a whole is really, really crucial to your craft. I used to work in internal medicine, and very, very tough specialty because you're constantly thinking out the box and constantly critically thinking. But, you know, if you have someone who's coming in, you know, with really bad headaches, you know, you learn to investigate further. And sometimes a lot of our aesthetic treatments can help. So I don't know if you know, but Botox helps with headaches too and chronic migraines. So continuing medical education is crucial, especially everyday life. You know, you're in a restaurant, someone, you know, is choking. You got to know your Heimlich maneuver. You got to know physical anatomy to be able to help.
I know we talked a lot about ethnic skin, and I'm ready to do Botox for the first time today. You ready?
I'm ready.
Let's go.
Essentially, this is going to be really short and quick. I'm just going to give you a series of injections in your forehead and your glabella. It's going to take some time for it to kick in, but I promise you, you're going to love it. Welcome to the dark side.
Let's go. Experience was dope. I got through it. We're done.
We're done. So remember, your rules, you're going to avoid laying down for the next 3 to 4 hours and try to avoid any exercise or sweating for the next 24 hours. Give some time for it to take effect. Usually about day 3 to 5 starts to kick in, but you need a full 2 weeks to let all of that kick in. I'm excited. I can't wait.
Me too. 2 weeks, you'll see the results. I'm excited. Now, I wanted to take it back to social media real quick. Who are some people on social media that you follow that are great tips? They share great tips, they're great injectors or great doctors or...
Yeah, absolutely. So I love Beauty by Dr. K. Love her informational videos. I think they're awesome. Fix Me Up LA, love those two, especially because they love pink. I'm super into pink. I also love Cutie Looks Med Spa. I really appreciate a lot of the showcasing of, again, clients who have color, them delving into a lot of the aesthetic treatments, facials, neurotoxins, fillers. You really appreciate the craft in different skin types.
Wow, amazing. Make sure to go follow those people. They will give you a lot of great advice, great tips. Well, it's been so great for you sitting down with me, speaking more about the aesthetic industry. Tell everybody where they can find you and what you have next.
So I can be found at Alluring Image Med Spa here in Delray, and also Intralift Med Spa in Plantation. Up next, you'll be seeing a lot more facial rejuvenation coming from me. That's it.
Amazing, amazing. Well, until next time, bye.
Bye.